Hi, I'm Jaja Fu from Fudan University. I'm really happy to introduce our work. Chronic disease treatment usually spans over years. During treatment process, physicians have to review large amounts of patients' historical medical data to make accurate treatment decisions. How to obtain information over review is a big challenge. Physicians in developed countries typically use ad hoc information summaries. However, it is not suitable for busy environments. Unfortunately, physicians in developing countries are usually very busy for severe shortage. For example, China lacks about two-thirds of pediatricians, which means about 100,000. How such physicians obtain information summary is an open question. To answer this question, we conduct our research in one of the best pediatric hospitals in China. Specifically, we focus on the three questions: how patients are treated there, how pediatricians obtain information over you during the process, and why. Actually, we have been conducting volunteer projects in this hospital since 2015 during our collaboration with physicians who were surprised by their extreme workloads. Now we begin to work on improving their work efficiency by helping with their information systems. This understanding work mainly reports our findings in the first phase. We found that patients are treated in the inpatient division when being hospitalized. Physicians there are very busy. They conduct ward rounds twice a day. They sometimes discuss treatment plans within a few minutes. After being discharged, patients have to visit outpatient division of the same hospital regularly, for example, monthly. Physicians spend 4 to 5 minutes on them. In addition, various physicians have to work collaboratively. During the whole treatment process, EMR is used when comprehensive data are needed, while follow-up sheet is the one providing historical medical data and chains of key information readouts, and the one used for physicians' communication. That is, follow-up sheet is actually used as an information summary alternative. Before explaining why, we first demonstrate what it is. The left two figures show the cover and content pages of follow-up sheet and nephrotic syndrome. The pages are glued together and form into a long list. That's how physicians use it. Follow-up sheet can well meet pediatricians' requirements. First, since physicians are very busy, they usually need to obtain critical values at a simple glance. Follow-up sheet contains a few essential items and omits the majority ones and provides enough data for follow-up sheet treatment. Second, physicians are required to get treatment trajectories within a few minutes or even seconds. The data in follow-up sheet are classified into different categories and form into a big two-dimensional table. The well-organized data facilitate quick comprehension. Third, physicians are required to work collaboratively. Follow-up sheet contains space for physicians to record clinical summaries, diagnoses, and treatment suggestions, which facilitate physicians' communication. First, physicians required to get needed information instantly. Follow-up sheet is stored in the outpatient division and brought to physicians before patients show up. The sheet can be stored instantly used, and no additional preparatory work is required. In conclusion, pediatricians are extremely busy and their requirements for information summary are complicated. Even though follow-up sheet is simple, it is a paper, it contains very rich information and meets the requirements. Actually, even though its effectiveness, the paper form brings a lot of overhead for usage and management. To improve physicians' work efficiency, we are now working on transforming it into a digital format. However, it faces many challenges. For example, how to demonstrate various types of data within a screen, both horizontally and vertically. If you have any suggestions, please communicate with us. Thank you for listening.